Bon après-midi, tout le monde, et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont le médecin hygiéniste en chef, le Dr. Jennifer Russell, et le Premier ministre, l'Honorable Blaine Higgs. Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Speaking on behalf of the province this afternoon are the province's Chief Medical Officer of Health, Dr. Jennifer Russell, and Premier Blaine Higgs. Dr. Russell.
Thank you, Bruce. Merci. Good afternoon, everyone. Bonjour à toutes et à tous. Today, I am providing an update on the outbreak at the Manoir Notre-Dame in Moncton. And I feel today's really important because we need to provide everyone with the most up-to-date information that we have so that people can help understand what the situation is and what we're doing about it. As I said yesterday, this outbreak was not unexpected, given that we are seeing outbreaks and increasing numbers in our neighboring jurisdictions. And so it did not find us unprepared. We did learn so much from the outbreak in the Campbellton area a few months back. And so building on these lessons during that time, we have moved swiftly to identify infected patients and staff and isolate from others. And that's really the critical point here with respect to the public health actions that we need to do immediately, and that is to make sure all the cases are self-isolating, which they are. And the close contacts are being contacted, and they are told to self-isolate, which, again, that is the biggest work that we need to do at this moment in time. So we have launched a coordinated response to care for those who have become infected and protect those that the virus has not yet touched. And I do ask that you have compassion and kindness and provide as much support as you can for the people that are touched by this at this moment in time. So residents who are infected, staff, whatever kind of support you can offer them, that would be great. And also keep in your thoughts all the healthcare workers who are providing care for the infected people right now. Today, I'm announcing that we have confirmed 17 additional cases of COVID-19, all linked to the outbreak at the Manoir Notre-Dame. With the 2 cases announced on Tuesday, there are now 19 confirmed cases at this special care home, and that is 13 residents, 4 healthcare workers, and 2 family members who were close contacts of an infected resident. So the 2 residents of the Manoir remain in the hospital and are in stable condition. We have reported 222 cases of COVID-19 in New Brunswick to date, and 22 cases are active at this time. Fort des leçons apprises lors de la première vague de la pandémie et l'éclosion à Campbellton, nous avons rapidement identifié les patients et les membres du personnel infectés et ils ont été isolés. Nous avons entrepris une intervention coordonnée pour soigner les personnes infectées et protéger celles qui n'ont pas encore été atteintes par le virus. J'annonce aujourd'hui 17 nouveaux cas confirmés de la COVID-19, tous liés à l'éclosion du Manoir Notre-Dame. Avec les 2 cas annoncés mardi, cela porte à 19 le nombre de cas confirmés dans ce foyer de soins spéciaux. Parmi les cas, il y a 13 résidents, 4 employés et 2 membres de la famille d'un résident infecté qui sont des contacts étroits. 2 résidents du manoir sont hospitalisés et leur état est stable. Il s'agit du plus grand nombre de cas quotidiens, je crois, depuis l'arrivée de la première vague au Nouveau-Brunswick. Alors, nous avons rapporté 222 cas de COVID-19 dans la province à ce jour et 22 cas sont actuellement actifs. Et je veux que tout le monde soit ont la compassion et donne du support et offre le support des gens ici dans cette situation, les membres de la famille, les résidents comme tels et les employés qui sont infectés, et les membres de leur famille et aussi les travailleurs de santé qui prennent soin de ceux qui sont infectés maintenant. Alors, gardez-le dans vos pensées. The surge in cases we are reporting is the result of our rapid response to this outbreak. So we were able to test the entire, almost the entire population of residents and staff in a 4-hour period and get those results really quickly so that we could begin the contact tracing really quickly. And so we processed those tests really rapidly, and we're able to, again, start the contact tracing, and all the family members have been contacted by social development. So we've had a lot of help from our partners on the ground, EMP, social development, public health, the RHAs. So our prompt team, which is the rapid response team, remains on site today, and we have updates in the morning and we have updates in the evening to make sure that all the things that are needing to be done are getting done. They're coordinating further measures to protect and care for the residents at this special care home. They're all being isolated. They're all pretty much in single rooms. They've had a visit from the ID specialist from the Moncton Hospital, and IPC protocols are in place, and PPE has been supplied as well. We are extending our care to all the families connected with the manoir. Social workers have been assigned to communicate with families and to offer assistance and support. Je tiens à dire aux familles touchées que mes pensées sont avec elles. Je comprends l'inquiétude que vous ressentez pour vos proches et pour les membres du personnel qui ont bien pris soin d'eux. La situation est d'autant plus difficile que vous ne pouvez leur rendre visite. The restrictions for visitation right now are absolutely necessary to protect the staff, the residents, and the general public. I thank all the families for their support and understanding at this time. And again, I ask that the public offer their support and their well wishes at this time. Une équipe de soins cliniques a été dépêchée au manoir pour aider le personnel à contenir l'infection. Les résidents sont tous isolés dans leurs chambres. La résidence comporte principalement des chambres pour une personne avec leur propre salle de bain, ce qui aiderait à ralentir la propagation du virus. Staff are being assisted with special training on the proper use of personal protective equipment to protect themselves and the residents. Contact tracing is underway, and the source of the outbreak remains under investigation. Je ne cherche pas à faire porter la blâme à quelqu'un et vous ne devriez pas non plus. La COVID-19 est autour de nous et nous devons faire face aux éclosions lorsqu'elles surviennent. La grande majorité de nos cas sont liés à quelqu'un qui a voyagé à l'extérieur de la région atlantique et a rapporté le virus ici sans le savoir. C'est pour ça que c'est vraiment important que les gens qui voyagent hors de la bulle et retournent devraient isoler pendant 14 jours quand ils retournent. It's really timely to remind everyone of the importance of following self-isolation rules for those who have traveled outside the Atlantic bubble. From our experience with temporary foreign workers and international students last summer, those travelers had all been self-isolating, and any of the cases that were positive in the end, they were diagnosed while they were self-isolating, and therefore they could not infect any other people. We expect people will travel outside the region in the course of their work and their personal lives, and until a vaccine or other effective treatment becomes available, those who are required to self-isolate must do so and follow the rules to the letter. If you are told to self-isolate, that means limiting your contact with others. Don't go to school or work, and don't go out to shop. Stay in a separate room and use a separate bathroom if this is possible. Si on vous demande à vous isoler, vous devez limiter vos contacts avec les autres. N'allez pas à l'école ou au travail et ne sortez pas faire les courses. Restez dans une pièce séparée et utilisez une autre salle de bain. Avoid contact with others, especially the elderly and those with chronic health conditions or people who work or live with those people. Keep your hands clean, avoid touching your face, and take care not to contaminate commonly used surfaces. Monitor your symptoms daily, New Brunswickers. Everybody in the province needs to monitor yourself for symptoms. We have easy access to testing now through 811, but also our online form that you can get referred for a test without having to go through 811. We all need to work together to protect the entire population, including the vulnerable populations. Adhering to these rules has been the key to getting New Brunswick into the yellow phase of recovery, and it is vital if we are to stay at this level. Each of us has a role to play in keeping New Brunswick in the yellow phase. It's all about continuing to do what you have been doing. Maintain 2 meters of physical distance between yourself and others whenever you can. When you can't, wear a mask or a face covering. Always keep a couple of masks with you when you're out, and make sure to wash them regularly. Wash your hands regularly and thoroughly. Cough and sneeze into your sleeve. Regularly clean high-contact surfaces like kitchen countertops and door handles. Stay home when you are sick. Get tested by using the online self-referral tool or calling 811. None of these actions will stop COVID-19 on their own. It's the combination of all of these steps that we all need to do frequently, regularly, daily to stop COVID-19. If we each continue to observe all of these actions to the best of our ability, then we will be in the best position to slow the spread of the virus, enable our health system to manage the cases we are now seeing. With the second wave of COVID-19 now upon us, all New Brunswickers should recall what got us through the first wave, what got us through the outbreak in Campbellton. Les règles d'hygiène sont importantes. La résilience est importante. L'exercice, l'air frais et une bonne alimentation sont importants. Friends and family are important. Kindness and compassion are extremely important. We can continue to act together to slow the spread of this disease and care for everyone who is being affected by it. Once again, we are all in this together, and once again, it is only by working together that we can get through this. N'oubliez pas, nous sommes tous dans le même bateau, et c'est seulement en se serrant les coudes que nous passerons à travers cette situation. Il y en a des gens qui sont touchés plus sévèrement par cette situation. Ils sont dans nos pensées, mais ils ont besoin de notre support aussi. So, we've made it this far, New Brunswick. We will get through this together. I thank you very much for all of your collaboration and cooperation. Merci. I do have one other point I need to make around some information that Public Health has provided around the potential for some public exposures. And those took place at the Moncton Costco Optical Center and at the Moncton St. Hubert restaurant. So people who have visited these locations since October 1st should self-monitor for symptoms for 14 days. And should any COVID-19 symptoms develop, they are directed to self-isolate and call 811 to get tested or take the self-assessment online. Thank you very much for your cooperation. Merci.
Good afternoon. Bonjour. The 17 new cases announced today represents the largest one-day outbreak our province has experienced to date. We've watched all across our country and in other countries, particularly in the U.S., over the last several months. And we've hoped that this day wouldn't come, but here we are. So what it means is we have to become even more diligent, even more focused on protecting ourselves and each other. This situation highlights just how serious our current situation is, but how serious this pandemic continues to be. It's easy to forget that when our numbers are low. COVID-19 is still with us, and it will be for the foreseeable future. We've repeated that message several times in relation to not getting accustomed to a normal until there's a vaccine. It's a normal with COVID. It's a normal with masks. It's a normal with social distancing. It's a normal with reduced numbers and activities that are different than they have been in the past. We are doing our very best to make life as normal as possible, but we know that it's not. Right now, the Provincial Rapid Outbreak Management Team for the Moncton region is working hard to contain this outbreak and limit the spread of this virus. Nous sommes reconnaissants du travail acharné accompli par l'équipe provinciale de gestion et inclusion. Nous remercions aussi le personnel du Manoir Notre-Dame pour son dévouement continu. Je veux dire aux membres de famille et aux amis qui ont des préoccupations concernant les résidents et le personnel de manoir qui nous faisons tout ce que nous pouvons pour assurer la sécurité de leurs proches. We are asking that every New Brunswicker do their part as well to keep our province and our most vulnerable residents safe and healthy. We cannot take chances. We understand that you want to spend your Thanksgiving surrounded by loved ones, but please keep your gatherings small this year and respect the criteria that public health demands. I too will be following the advice of public health, and we will be having a very small gathering to celebrate this year's Thanksgiving. Si nous limitons nos contacts, ce sera plus facile pour la santé publique de faire la recherche des contacts si une personne est malade. Et ce sera plus facile de nous protéger les uns les autres. If you haven't downloaded the COVID Alert app, please do so. This app is another tool for us to use to keep one another safe and informed. The health and safety of New Brunswickers continues to be our top priority. It is understandable if you have concerns about what is happening in our province and about COVID-19. Étant que province, nous avons connu des temps difficiles dans le passé et nous avons surmonté ces tempêtes. Nous avons réussi en travaillant ensemble et en prenant soin les uns des autres. Every New Brunswicker has a role to play. We need to continue the diligence of washing our hands, maintaining physical distance from others, and wearing a mask when necessary. And if you are ill, stay home. We are depending on each other to do our part and to keep our province safe. We will recover from this outbreak, and we'll do so with everyone's help and the diligence of the great workers that are now doing the contact tracing and identifying just how widespread this outbreak really is. I thank each and every one of you for continuing to be diligent. Merci.
Merci, Monsieur le Premier Ministre et Dr. Jennifer Russell. Thank you, Dr. Russell, Premier Higgs. We will now proceed with questions from the media. You have the right to pose your question in the language of your choice. Nous allons maintenant procéder aux questions des journalistes. Vous avez toujours le droit de poser vos questions dans la langue de votre choix. Each reporter will have one question and one quick follow-up. Chaque journaliste aura une question et un suivi le plus rapide possible. Michel Corriveau, Radio-Canada.
Bonjour, c'est une question pour Dr. Russell. Dr. Russell, j'aimerais savoir, puisque c'est la plus grande augmentation de cas depuis le début de la pandémie, pourquoi ne passe-t-on pas la phase orange dans la région 1?
Bonjour, Michel. Alors, ça, c'est quelque chose qu'on discute maintenant parce qu'il y a des changements sur nos phases d'alerte depuis le commencement du pandémie. Alors, ça fait peut-être un mois ou deux qu'on a mis d'autres changements sur le site web pour annoncer qu'est-ce qui arrive dans les différentes couleurs, puis qu'est-ce que sont les choses qui déterminera si on change. Alors, maintenant, on est en train de faire les recherches sur les contacts étroits. Alors, ça, c'est une des choses. Si on ne peut pas faire toutes les recherches dans les contacts étroits dans une certaine période de temps, et aussi si c'est un risque à cause que c'est dans une résidence avec des populations vulnérables, s'il y a un risque qu'il y aura de la transmission communautaire, c'est ça qu'on détermine maintenant. Alors, on détermine que ces choses sont pas accomplies ou ils sont en place, c'est ça, on va décider d'aller dans la phase orange, mais on n'a pas toute l'information maintenant pour décider ça, mais c'est une bonne question et je sais qu'il y a plusieurs gens qui demandaient la même question.
Merci, docteur. As-tu un suivi rapide, M. Corriveau?
Oui, toujours pour Dr. Russell. Combien de personnes sont en quarantaine préventive maintenant?
Je n'ai pas le nombre de personnes de contact étroit à ce moment-ci, mais je sais que tous les cas sont isolés maintenant et tous les contacts étroits qui ont été contactés dans les recherches sont en isolation, auto-isolement maintenant.
Merci, M. Corriveau. Andrew Watt, Telegraph Journal.
Yeah, my first question is to Premier Higgs. Premier, what would you say to the people of Zone 5 who were very upset that they got moved back into the orange phase and now we have an outbreak that's bigger than the total outbreak in Atholville, yet the province isn't moving that zone back into orange yet?
Hi, Andrew. I'm going to take that question because I actually just answered it in French. So the situation is different for a couple of reasons. One, our phases have changed in terms of what the different phases look like and the triggers, and so that's been on our website probably for a month or so. And at this point in time, because we've done the multitude of testing last night and have all the cases self-isolating right now, and we're continuing to do contact tracing, and those contacts that have been contacted so far are self-isolating. Again, we're continuing to gather more information to complete our risk assessment to make a decision about Orange. But certainly, the situation in Campbellton included one adult residential facility, 2 different daycares, and a hospital. So those are multiple settings right now in terms of exposure. Right now, this outbreak is contained in terms of diagnosed cases to one facility. However, when we look at the different triggers from an epidemiological perspective and from a public health perspective in terms of the actions that we need to complete, we do have to make sure that we contact all of the close contacts within 24 hours. So we're working on that. This is an outbreak in a high vulnerability setting where there is a risk of transmission to the community. So we're looking at that as well. So once we gather all that information and finish our risk assessment, then we'll make a decision about whether to go to Orange.
Thank you, Dr. Andrew. Do you have a quick follow-up?
Yep. Again, to Dr. Russell, didn't you say one of the potential places of public exposure was Costco? Like, does it get much busier than that in New Brunswick? And Moncton's the biggest city. Surely there's a way bigger risk of community transmission in a place like Moncton and in a store like Costco than there is in Atholville.
Andrew, my parents shop at Costco all the time. It is in the Costco Optical Center, and it would be people who have been there since October 1st. The contact tracing is continuing, so there will be more information as more information comes in. And in terms of, the entire province is supposed to be self-monitoring at all times anyway. And again, we're letting you know all the information that we have at this point in time, so the public can take actions for their own situation and their own behaviors at this moment in time. So all those people who have been at the optical center, those people should self-monitor. And if there's anything else that needs to be done, public health is following up with contact tracing around that exposure as we speak. And again, it's easy to get tested if you have symptoms. You can call 811 or you can take the self-assessment online.
Thank you,
And
Dr.
also, and the other exposure was at the Moncton St. Hubert restaurant.
Thank you, Mr. Waugh. Thank you, Dr. Timothy Jakes, Campbellton Tribune.
My question is for the Premier. The Mayor of Pointe-à-la-Croix, Quebec, questions why people from nearby parts of Avignon outside the bubble can't enter his community to shop, apparently because New Brunswick insists on it, and thinks his community may have to leave the bubble rather than cut off its neighbors. So what is the status of that bubble as of today, and would it be possible, if Pointe-à-la-Croix leaves, to keep a bubble with Listigouche First Nation, which has 106 students, I understand, attending high school in Campbellton?
So that has been the concern with the students that are traveling into New Brunswick from the First Nations community, and I guess that we're now looking at options in that sense. We don't see right now, especially given the current situation, there will be any expansion of that bubble, and if it becomes necessary to close the northern border with Quebec, then that is a possibility, and we will work with the First Nations community on how to make that as painless as possible, but also recognizing the need for the students and how we can best accommodate their needs, even if they are restricted to the border crossing. But further expansion is certainly not in the cards at this time.
Thank you, Premier. Mr. Jakes, do you have a quick follow-up?
Yes, for the Premier, just to clarify, when you say expanding the bubble, do you mean that includes neighbors of Pointe-à-la-Croix coming into Pointe-à-la-Croix to do their shopping and things like that? Is that what you mean?
Yeah, what I understand is that there's some local, certainly anxiety or complaints about the fact that we're monitoring people coming and going into the community, basically turning people away that don't have an essential reason to do that. That's the way we've protected communities here in New Brunswick, and that's the way we would agreed with the chief in relation to protecting his community, that would allow us in order to keep the students moving back and forth. So if that border that was set up with the Quebec police in order to monitor activity in the community, if that border is not acceptable to the residents outside of the Louisquay community, then it becomes problematic. And we will have to recognize that's not workable.
Thank you, Mr. Jakes. Travis Fortnum, Global News.
Hi there. I understand that the start of this outbreak is still under investigation. If it were someone who traveled from outside the Atlantic bubble and visited this long-term care home without self-isolating, is it possible that charges could be placed?
As I said during my speech, we're not looking for blame in this situation at this point in time. We're really looking for compassion and kindness, and we're looking for what we need to do to move forward to contain this outbreak at this time. And preferably, we would like to stay in the yellow phase while we do that, if that's possible. New Zealand just came through an outbreak, and they were able to do it without having to close down businesses, et cetera, and keep people at home. So we certainly, whatever pieces of information we find around what the different sources are potentially, then we're going to look into that, and we will certainly investigate that.
Thank you, Doctor. Mr. Fortnum, do you have a quick follow-up?
I do, also for Dr. Russell. Just wondering, and you touched on this in your speech as well, but what the condition of the patients are.
They are stable
the
right now.
cases.
The patients who are hospitalized are stable right now. And I just want to clarify the point I made about my parents shopping at Costco. I think prior to COVID, they shopped at Costco. I actually don't know if they've shopped at Costco since COVID happened.
Thank you, Mr. Fortnum. Thank you, Doctor. Vicki Hogarth, Charlotte County TV.
Thank you, Bruce. My question is for Dr. Russell. Dr. Russell, do you know what protocol visitors to the manoir were following? What were they asked, or what did they have to do when they came to visit?
Sorry, the question is about protocols being followed for visitation at the manoir?
Yes.
So I had a comment about this yesterday, and what my knowledge of what our recommendations from a public health perspective have been were communicated to all ARFs and long-term care facilities a while back, I believe from a memo from the Pandemic Task Force around what safe visitation would look like. But each and every facility, I guess that was on August 31st, but each and every facility was going to determine how to operationalize that themselves, and that would be based on the types of patients they had, how frail they were. We had been recommending outdoor visits, and also, the type of staffing that would be necessary to facilitate those type of visits would differ from place to place. So I don't know the exact details around what kind of visitation the manoir was able to operationalize. I just know the general advice that we had been giving to all of the facilities.
Thank you, Doctor. Ms. Hogarth, do you have a quick follow-up?
I'm just wondering if you know about how many visitors have been to the manoir in the past week.
I don't know the exact number. We're looking in, the people that are doing the contact tracing are actually contacting all the visitors, and my understanding is that social development actually contacted the families of all the residents, so that would be part of the contact tracing that's taking place right now.
Thank you, Ms. Hogarth. Simon Delatte, l'Acadie Nouvelle.
Oui, bonjour, une question pour Monsieur Higgs. J'aimerais savoir si c'est une clarification qui va être apportée prochainement au sujet du port du masque dans les lieux publics, et est-ce que l'éclosion que l'on constate cette semaine pourrait changer ou influencer votre décision?
The COVID Cabinet Committee and Cabinet are meeting tomorrow on certainly understanding the compliance issues around following public safety rules. This situation will definitely be a factor in the discussions around the future requirement for masks. But the decision will be made, tomorrow in our committee, our Cabinet Committee meetings. I think that, when we said we wanted to make changes to some of the activities in order to ensure adherence and compliance with being followed, what we're learning and will learn through this outbreak will help us to make better decisions to tighten rules. We've asked, and Dr. Russell just referenced, it's not about laying blame or laying charges. It's about people taking a responsibility to protect themselves and others, and not being complacent about the risk. This is definitely a wake-up call, one that we certainly didn't want to see, but one we were very concerned might happen. So we'll learn from this, and we'll make decisions accordingly as a result.
Merci, Monsieur le Premier ministre. Monsieur Delatte, as-tu un suivi?
Non, merci.
Merci. Mia Urquhart, CBC.
Thanks, Bruce. My question is for Dr. Russell. Are you any closer to knowing how COVID got into the Manoir Notre Dame?
So our public health team and the social development team and working with EMP, they're all working very, very diligently right now to trace all the contacts and do what needs to be done to get this outbreak under control. So again, right now, the cases who've been diagnosed at this moment in time are all self-isolating, and the close contacts of those people are being traced and contacted and told to self-isolate.
Thank you, Dr. Ms. Urquhart. Do you have a quick follow-up?
I do. With so many workers in isolation, how are the residents being cared for?
So my understanding with the team on the ground, we sent in our prompt team and EMP, again, lessons learned from the outbreak in Hamilton. We have mobilized some staff to be able to have the residents cared for by a critical care team, which is on site at the moment.
Thank you, Ms. Urquhart. Thank you, Dr. Russell. Mathieu Wacomo, l'Acadie Nouvelle.
Ma question est pour Monsieur le Premier ministre Higgs. Monsieur le Premier ministre, l'Assemblée législative s'est choisi un nouveau président aujourd'hui. Pourriez-vous commenter ce choix des députés de Monsieur Bill Oliver?
Yes, certainly. I'm very pleased with Bill taking on the role of Speaker. I mean, Bill has a tremendous amount of experience certainly in the legislature, but as certainly going back years ago to being an executive assistant to a former Speaker, Bev Harrison, and so he's worked in not only the legislature directly to understand the procedures and protocol, but he's worked certainly as an MLA, as a minister of the Crown. A wealth of experience in our province and brings again stability and continuity and a great deal of knowledge to the role of the legislature.
Monsieur Wacomo, as-tu un suivi cet après-midi?
Oui, toujours pour le Premier ministre. Monsieur Higgs, pouvez-vous nous expliquer sur le même sujet votre rôle dans le choix de Monsieur Oliver? Est-ce que c'est vous qui avez choisi qu'au sein de votre caucus, Monsieur Oliver serait le candidat, ou est-ce que vous avez laissé le caucus décider lui-même? Comment ça a fonctionné chez vous?
Well, it worked the same as I think every selection of Speaker. I mean, certainly I supported Bill. But there was an option for others to participate should they choose to do so. And if you were following the proceedings, certainly there was one candidate that was planning to offer as well and declined during the actual legislative process when Bill was being sworn in or voted in. So it's how the Speaker. I don't think there was anything unique to the process this time over past selections.
Merci, Monsieur Wacomo. Thank you, Premier Shane McGee, CBC.
Hi, this is a question for Dr. Russell. Can you tell us more about this exposure at St. Hubert's? We're seeing that an email that suggests an employee at the location has tested positive after being a contact with one of the home residents.
I don't have that information. We are looking into everything that we can at this time. So I was just informed about the possible public exposure at the St. Hubert just before I came into the press conference.
Mr. McGee, a quick follow-up, please.
I asked yesterday about the workers at the home. I'm just wondering if you can say whether any workers at this home worked elsewhere and whether there's any concerns about that.
Well, again, the teams on the ground are gathering that information, and from a risk perspective, they would determine if there was a risk at any other facilities if that were the case. I don't have, again, my teams on the ground are looking into that right now with all of the contact tracing they're doing.
Thank you, Mr. McGee. Inda TR, Huddle Today.
Hello, this is a question for
both Dr. Russell and the Premier, I guess. Just wondering, given that the two places for potential exposure were businesses, what does this mean for businesses in the area in terms of the public health rules that they have to follow?
Well, Costco had already implemented their own mandatory mask directive. So my understanding is the Costco mandates that you wear a mask when you go into that particular facility. I'm not sure about the St. Hubert, but certainly I'm assuming that those establishments would have also alcohol hand sanitizer for people to use when they entered as well.
Do you have a follow-up today?
Yes, please. Yeah. I guess this is for the Premier. Will this change travel within the Atlantic bubble at all?
Well, certainly we would like to think that it won't. Again, it'll depend on the extent, and I'm sure my colleagues in the other provinces will be following this closely. I've already heard from one Premier in regards to their support to help us any way that they can. I do have a meeting with all the other premiers in the coming, I think, 2 weeks out, but we'll know a lot more in several days, not in certainly a longer period than 2 or 3 days. We'll know the situation. So right now, if we can contact trace, if we know and can surround this and get it under control, then I would say it won't affect the bubble throughout the Atlantic region. But if there are unknowns after several days of tracing and contacting, I'm sure my colleagues will want to know those details, and I've already committed to share them completely.
Thank you, folks.
Thank you, Doctor. Thank you, Premier.
Thank you. Nicolas Steinbach, Radio-Canada.
Bonjour, cette question pour le docteur Russell. Bonjour, docteur. Écoutez, hier, c'était 2 cas, aujourd'hui 17. Est-ce qu'on craint que le pire soit à venir ou c'est derrière nous au moment où on se parle, où on craint d'avoir encore plus de cas demain et après-demain?
C'est vraiment difficile à dire parce que c'est 14 jours avant qu'on va voir combien d'autres cas qu'on va voir à cause de les premiers cas qu'on a déterminés, qu'on a diagnostiqués. Alors, c'est vraiment les prochaines 2 semaines qui vont nous dire combien d'autres cas on va voir. Puis ça va nous dire comment rapidement qu'on a pu isoler ceux qu'on a diagnostiqués, les contacts étroits, et si les contacts étroits développent des symptômes, ils sont testés, etc. Alors, ça va être au moins 2 semaines avant qu'on va voir qu'est-ce que cette éclosion va développer, comment ça va dérouler.
Justin Bach, as-tu suivi cet après-midi, monsieur?
Oui, rapidement, merci. Dr. Russell, deuxième question pour vous. Juste pour clarifier, au niveau de l'origine de cette éclosion, est-ce qu'on doit comprendre aujourd'hui que c'est quelqu'un qui vient de l'extérieur de la bulle atlantique et que cette personne ne s'est pas isolée lorsqu'elle est revenue de l'extérieur? Est-ce que c'est ça? Alors,
jusqu'à maintenant, la plupart des cas sont des cas de voyage. Alors, c'est quelqu'un qui a travaillé en hors de la bulle atlantique, soit au Canada ou soit international. Et on a vu avec les étudiants étrangers et aussi les travailleurs étrangers. Dans ces cas-là, ils sont isolés pendant 14 jours et on les testé en la 10e journée. Et tous ceux qui ont été positifs dans ces situations-là n'ont pas eu la chance d'infecter d'autres gens parce qu'ils étaient en isolement. Alors, on sait que les 14 jours d'isolement, c'est vraiment la chose qui est plus importante quand que les gens voyagent dedans de la bulle. Mais il y en a des gens qui voyagent pour des raisons essentielles et ils ont des exemptions, mais ces gens, ça se peut que c'était quelque chose qui a contribué, mais on sait que le risque pour la transmission communautaire existe aussi et on n'a pas fini notre investigation et nos recherches et les traçages et recherches des contacts étroits à ce moment-ci. Alors, au fur et à mesure qu'on a d'autres informations, on peut le partager, mais maintenant, on n'a pas assez d'informations pour dire oui ou non, est-ce que c'est un cas lié au voyage, oui ou non.
Merci, monsieur. Héloïse Rodriguez, Radio-Canada.
Oui, bonjour. Dr. Russell, vous l'avez dit, il s'agit d'une population vulnérable. Je me demandais si, vu la situation, vous comptiez interdire les déplacements de main-d'œuvre entre les différents foyers de soins pour les protéger et sinon pourquoi?
J'ai pas entendu toute la question, mais je sais que c'est au sujet des ressources humaines qui travaillent, les travailleurs
Oui,
entre différentes...
interdire les déplacements entre les différents foyers de soins des employés.
Alors, les politiques, c'est quand il y a une éclosion, c'est dans cet instant-là qu'on va arrêter le déplacement entre des endroits. Alors, cette situation aujourd'hui, les directives sont là que, à cause qu'il y a une éclosion, les gens ne devraient pas travailler dans plus qu'une entreprise. Mais on l'examine maintenant avec les équipes qui sont en train de travailler sur la situation maintenant, sur l'éclosion.
Tu as suivi?
Oui, merci. Je sais que vous n'avez pas fini le traçage des contacts encore, mais pour avoir une idée de l'ampleur de la situation, est-ce que vous pouvez nous dire combien de personnes sont en isolement préventif en ce moment?
J'ai pas cette information dès que maintenant, mais au fur et à mesure qu'on l'a, on peut vous donner l'information. Dans le cas de Hamilton, on avait comme au moins 1000 contacts étroits, mais quand on a tracé tous les contacts, on a vu que c'était vraiment 400 parce qu'il y avait comme des contacts en commun avec d'autres. Alors, au fur et à mesure qu'on a cette information, on va partager.
Merci beaucoup. David Coach. Time to transcript.
Yes, the question is for Dr. Russell. A resident at the Manoir Notre Dame in Moncton was taken to the Moncton Hospital 3 times over the past week with symptoms including fever, headache, chest pain, and fatigue, according to her granddaughter. She believes her grandmother wasn't tested for COVID-19 despite showing symptoms of the virus, and her grandmother has since tested positive and is now on oxygen. I know that you can't comment on individual cases, but how could this kind of oversight occur?
Well, you are correct. I can't comment on individual cases, and so all I can tell you is that both regional authorities are working on any possible exposures at the moment.
Do you have a quick follow-up?
More generally, can you describe the COVID testing protocols in effect at the Moncton Hospital and hospitals across the province?
Well, the information that we have provided through the Pandemic Task Force would have been broad, information that would have been operationalized at the RHA level. So I don't actually have those details, but the RHAs would be in a better position to comment on that information.
Thank you. Geneviève Normand, Radio-Canada.
Oui, bonjour. Ma question, c'est pour la Dr. Russell. En fait, vous avez dit qu'il y a 4 employés qui ont testé positif à la COVID-19. Je voudrais savoir si ce sont des employés qui ont travaillé dans un autre centre de soins récemment.
On continue à faire le traçage des contacts étroits, etc. Alors, c'est les équipes dans la région qui sont en charge de ce travail. J'ai pas des nouvelles sur ceux qui ont testé positif ont actuellement travaillé dans d'autres endroits. Mais au fur et à mesure qu'on a cette information, ça va nous informer des directions et des actions. S'il y a des risques à d'autres endroits, ça veut dire qu'il faudra faire plus de travail pour mettre en place des plans d'action pour mitiguer le risque.
Merci, Dr. Geneviève. As-tu un suivi?
Oui, et mon suivi, en fait, c'est à propos... en fait, j'en ai 2 suivis, si c'est possible.
Non,
je voudrais savoir, vous dites qu'il y a 13 résidents qui sont infectés. On sait qu'ils sont 112 dans ce centre-là. Il y en a 2 qui sont à l'hôpital. Qu'est-ce qui est fait à l'intérieur du manoir Notre-Dame? Est-ce que, j'aimerais ça comprendre un peu, là, logistiquement, est-ce qu'on a mis les patients positifs, par exemple, dans une aile séparée? Il y en a seulement 2 qui sont à l'hôpital. Est-ce que ce sont des chambres partagées? Comment est-ce qu'on s'organise au manoir pour essayer de limiter la propagation?
Alors, cette manoir, la plupart des résidents sont dans des chambres seule une personne à la chambre puis une salle de bain propre pour eux. Alors ça veut dire que le risque d'infection entre les résidents est minimisé parce qu'ils sont seulement une personne dans chaque chambre. Alors ça, c'est l'information que j'ai maintenant, mais l'équipe qui travaille à la manoir, ils sont en sécurité en scène. On avait eu une visite d'un des spécialistes hier soir pour vraiment donner beaucoup d'informations et une des infirmières pour les protocoles pour faire certaine que c'est suivi comme il faut.
Merci beaucoup, Geneviève. Merci beaucoup, Dr. Russell. Voilà la fin de notre mise à jour pour aujourd'hui. That concludes today's update. Thank you very much.